and really talk about how to make these changes. Thank you.
Thank you, Larissa. That's a great point in terms of making distinction between public health and healthcare. Uh, I have to admit, I love my job. I'm not a clinician. That's not my background. My background is in systems change. And however, when systems have to be changed, you have to provide some alternative or some method of where it's going to go. I have a team of people that includes biostatisticians, also people who are experts in the field, physicians, registered dietitians, exercise physiologists, because I want to make sure that what we're doing in terms of investing in public health and investing in healthcare is going to be evidence to be actually effective. So when I hear about things that are being done, uh, I want to make sure we have some impact. We do every 3 years a community health needs assessment. Again, addressing the issue of public health. What we've identified in our community is probably not very different than in other places. We have identified areas of chronic health prevention, chronic health management, obesity, infant mortality, and now behavioral health has risen to be an issue that we need to address. So those are the 5 areas that we have to focus on. And in the past, the work of this department that I work within, we tried to do that in a scattershot type of way, where we issue out public service announcements. You know, you should eat this, you should exercise, and it really wasn't moving the needle at all. So what we found is we have to provide direct services to population, but on a grander scale, and to have systems now provide services in that way to impact people, individuals, but hopefully move the needle on a community-wide basis. For example, if I look at chronic disease or chronic disease prevention, we know that certain populations have an elevated risk for particular chronic diseases. And if I were to measure what the baseline is for that particular population, and if I were to provide a general information, there'd be no impact. Truly, I couldn't say that because of this public information that we have had an impact. However, what I do is we have set up programs that, for example, we might have 20,000 people that are involved in a program where we'll do a biomedical screening to establish a baseline for each individual. Then we'll provide a series of interventions, whether it's in area of physical activity, nutrition, general health literacy, behavioral health screening, and then we provide interventions and being very intentional about that and measure to what degree did you change your eating habits. For example, show of hands, how many of you eat a serving of at least one serving of produce per day? How many of you eat 2 servings of produce per day? How many of you eat 3 servings of produce per day? How many of you eat 4 servings of produce per day? How many of you eat 5 servings of produce per day? The standard is 5 servings of produce or vegetables per day. Many people don't do that. The average is 1.2 servings of produce per day. So people are under eating a lot of what they should be eating. Let's talk about exercise. Per day, let's see this. During the course of a week, on an average of 7 days, how many of you exercise for at least 30 minutes per day? All right. That's the goal. 180 minutes of strenuous physical activity per week. I'm sorry. So that's what we're trying to do. And most people get about 5 minutes of strenuous, on average, 5 minutes of strenuous activity per week. So we're way down. We're way down. That's why we're getting so sick. You know, that's because of that. So what we do is we offer things like physical activity. We have people that we have running clubs, biking clubs, walking, yoga, just for people to become active, to make it accessible for people. There's passive places for recreation. There's parks, but they sit empty. Nobody goes out there. So we're trying to program things, have things for people to go out and do things, and then measure to what degree has this made a difference. So I'm looking at some of the things that are being talked about here that are very effective, which is great. But I think just doing the right things are good, but we have to measure to what degree have we made a difference. And then also, what effect has that had? If I have a population, for example, that has a higher or an elevated risk for chronic disease, to what degree did we diminish that? To what degree did we fend off things like diabetes or heart failure or the use of medications, because there's a financial return in doing that. So that's what I'm trying to measure is what the impact is and what is a cost-effective way of doing this. And I've done this where I've given people memberships to health clubs and they don't use them. You know, these are expensive health clubs. They can go in, they have a personal trainer, they don't show up. You know, they don't. They go the first time, they get tired, they get sore, and they say, I'm not doing this. This is brutal. So I'm trying to find ways that are effective for people, whether it's yoga or something that they can do in their own home, And what I find that there's some obstacles that we work with people. For some that they can afford it, they can go to they can afford to eat healthy, but they don't. They can afford to go to a health club, but they don't. So it's a matter of behavior. It's a matter of social conditioning. And what I found is that wellness is not about healthcare system. Wellness is about what happens in an environmental setting. That the social determinants of health really have about 80% to do more with how healthy you are than it does with the healthcare system. We have a phenomenal healthcare system in the United States, but our population is getting increasingly sicker, and it's because we're not accessing wellness. We have healthcare, but we don't have wellness, and we're hoping to transform that by these sort of initiatives and prove that these are effective and that they're financially sustainable and that we can then transform systems. If I look at healthcare system, or I'm sorry, food systems, how we sell food in a grocery store, in a restaurant, and if you go to an American restaurant and you get a serving of food, there's enough for 4 people when they serve you. And some of the things that they serve you is full of carbohydrates and things you probably shouldn't be eating, processed foods. And so, from a health perspective, we need to transform that as well because we're not doing ourselves any service. Even in our own hospital system, we have cafeterias that serve food that will kill you. And I've said to them, you need to stop doing that. You need to start serving so that we're helping our patients, even our visitors, eat and meet the goals that we're trying to establish for everybody else. Because we're going to we're undermining our own goal, and that's really not a good way to go. So we're trying to do this in a way that it's we have a bit of an experimental or innovative place where we can do this, but yet want to make sure that it provides some return for people that want to be healthy. And because it's my focus is on those that are medically underserved, the low income people with barriers to health care. I have to also make sure that it's financially effective because I want to make sure every provider can do this, and even for people who can't afford it, that we can do it in an affordable way. And so that's what I'm doing, working with people on a macro level to change food systems, to change recreational programs, how parks are designed, how walkways, walkable communities are designed. There's a study of area called, or these areas called blue zones, and there's 5 cities that were identified throughout the world that they have longevity of more than 10 years. For example, a male life expectancy is 72. In these zones, the life expectancy for a male is about 82. For women, it's almost 90 years old. And so this person studied why there such a difference here in these areas. And they identified 5 factors, 5 variables. One is they had a slower pace in lifestyle. They weren't governed by technology. They slowed down. They what they say how he described it is that they downshifted. They weren't on a heavy fast pace. They would slow down and have a very balanced approach to life. The other was the center on a plant-based diet. They ate a lot of, at least 5 servings of fruits and vegetables per day, and their meat consumption was on average at most 2 servings of meat per month. So that was the other plant-based diet. The other was a social integration. They had a network that either was because of friends, a close-knit circle of friends. For example, in Japan, there's a city there that they're grouped together there and had cohorts that they were with since they were infants, and they're here now into their 80s and 90s and still hanging around the same people. So although they're not related, they have these cohorts of people, about 30 people, that they've grown up with, and so they really have adopted each other as this extended family. So that was the other social integration. The other was physical activity, and it's not necessarily strenuous, but being active. For example, walking. They don't drive very much. They would walk where they go. They would bicycle. So it's not high impact. It's not high strenuous activity, but it is consistent activity, consistent physical activity. And the last was some sort of spiritual connection, not necessarily religious, but spiritual aspect in their life. So those 5 components were identified to be common traits among these blue zones, and because of this were factors in increasing the life expectancy by 10 years for this group. So we're taking that approach and then using entire communities, rural communities where there's smaller populations, and then trying to adopt those sort of principles in this community. So we're helping redesign their urban landscape so that the communities are walkable. So there's opportunities for bicycling or even snowshoeing in the middle of the city. Also finding ways of them to socially integrate. And then, of course, the religious or spiritual life, we leave it to themselves, but they're strong in that area. So we're trying to do that, and again, test, has this really had an impact with terms of longevity? So that's how we do it. And then finding out how much did it cost to do this. We still have to maintain our streets and sidewalks. We have to maintain infrastructure, but why not invest in a way that's going to improve population health as well?
Great presentations. Thank you very much. I didn't hear you talk about education, and I think that's probably very, very critical because it starts in the home when you're growing up. And I don't know, I'm from the UK, and there is a famous chef called Jamie Oliver. Do you know who he is? Yeah? He throws everything together and it's all healthy level. Well, he's made it a personal goal, and he's awesome. He's made it a personal goal to work with the UK government, and he's trying to work with the US government. It's particularly in LA, I think a school in LA, where he filled a several school buses with sugar to shock the American nation as to how much sugar the schools are giving the children in soda in lunch at lunchtime and during the day. You know, and what he's doing is he's even trying to put a tax on sugar in the UK. He's trying to I mean, I think that's pretty radical. I'm not saying that that's the right thing to do, but I think that it takes, you know, these really strong, passionate individuals that will stand up and actually, you know, try and push forward for the sake of the children. And I think the education is one of the areas I would like you to just comment on. What are you doing in terms of education?
Um, so I can kick it off and then we can go down. But I'm glad you brought this up. I mean, food security is a major issue for us. We work in a food desert, and education is one of the mechanisms that we employ in trying to teach our members what it means to be healthful. So not only do we do just preventative care, population health initiatives, but we do have curriculum focused on specifically healthful lifestyles, and we have an instructional kitchen in our clubhouse as well. The long-term vision for us, my hope is that we can build hydroponic urban farms in our back lot to provide food and care for our kids and our community, because what we are facing right now is that we don't have a grocery store nearby. We don't have access to nutritional products. We don't have access to produce. So what can we do as an organization that can once again step in? But you're right. It's, you know, we do teach our kids, but when they don't have access to the food, that's that's the other part of the challenge that we face, at least.
Sure, I'm familiar with Jimmy Oliver, and one of the things that he's done as well in schools is to because kids aren't used to eating healthy foods because they feel because it's green it tastes awful and they've never really tried it. So what he's done is he's worked with kids and experimented with them to say, okay, we're going to pick out some green beans, some broccoli, some kohlrabi, and then you're going to prepare it, and then we're going to vote as a group. You know, which do you like best? Because then those will be items that will be featured on our in the cafeteria. So they do this. So they now have appreciation for how to do this and how to prepare it, how to eat it, and how to appreciate it. So he's done some really great things that way, and very innovative because he's exciting movement this way. What we've done as well. I mean,